Good afternoon, ladies and gentlemen. You all look so beautiful and so elegant in your traditional attire. Omi ngaphambili unompumelelo wakambethe. I'm known as Mpumi Orulelo. I am born and bred in Malahleni. So, 10 May 1992, I was born in Witbank General Hospital. So I am so privileged today to celebrate my birthday as a speaker today. Thank you so much. I would like to acknowledge the representatives from the Emalahleni local municipality, our esteemed speakers, the board of ECFW, as well as the guests. We wouldn't be here today if we did not have the hearts of generosity and giving back to the community. So, as mentioned, Dr. Lupumelelo, I'm a general dentist. So I'm going to be very short, straightforward, like we like to practice when you come to our practice for treatment. Because when people arrive, so you know what, let's get the job done and be sharp. So my topic is smiling for two. It starts with you, mom. So in dentistry, most of the time, people think about it as pain, and ukipizinyo, and they're going to butcher me and all of that. And that's not true. So it must start with you, mom. As we know, tomorrow is Mother's Day. So as we know, mothers are nurturers, not only limited to biological mothers, but auntie moms, omamncane, mamkhulu. So this is for you as well, even if you're not a biological mother yet. So dental health, I'm going to speak about women's dental health, smiling for two, and then giving back. That is why we are here today. So you'll ask yourself, why dentistry? I mean, with giving back. But if you can go to the hospital, or to a local clinic, you will find there's a very long waiting list. But you can only be attended to in 2 weeks' time. Imagine sitting with that pain for 2 weeks. Imagine even worse, the child sitting with that pain for 2 weeks. My mother is a former teacher, athi umntwana amthole ahleli etafuleni alele angakhona ukufunda eklasini ngoba uphethwe yini uphethwe izinyo akakhona ukufocus. How many times do we see patients or do you take your child to the dentist angakhona ukuya esikolweni because uphethwe izinyo? So imagine now a child without any parents. Imagine they do not have medical aid or the funds to take them to the dentist. So this is where it all comes together. Dental health is very important. It's not the last thing on your mind because it's going to be the first thing you want to do in the morning. So I'm going to address you, our guests, because you are mothers, you are women, you've got children, you need to know this. And without our teeth, you can't smile. We're smiling. We're able to speak today because why? We have teeth. We're able to talk today, why? Because we have teeth. We can eat because why? We've got teeth. So teeth are important. Okay, what is health? So according to WHO, this is their definition. So it's a state of complete physical, mental, and social well-being, not just being free from disease and infirmity. So if I'm as then I can say you're not completely healthy. You need to check that out today. So women's health, I see a lot of women in my practice because they feel more comfortable when a lady is treating them. So our dental health is important for our well-being. Like I say, the first thing you want to do in the morning is see the dentist. Sometimes people can call me like 7 in the morning to like using your link pads and hurry up and just get to the practice. And you know us, we like having slow and easy mornings, but pain is pain and we need our dental health in order to have our overall well-being. So a healthy mouth belongs in a healthy body. And dental health as women, it's influenced by different stages in life and hormonal changes. We as women, we are very hormonal. It's just that people can take that statement, because, oh yeah, you're moody because of the hormones. No, we are just composed of a lot of hormones. So maintaining good dental health throughout those stages is very, very important. So when do we have those changes in life? So in puberty, when the menstrual cycle starts, maybe some of you may notice before your period starts, my gums are a bit inflamed, the pain is just too much, or the gums are bleeding. As well as pregnancy, I think that one is one of the worst ones, because there's fluctuations in your hormones, there's changes in your hormones. Yeah, there's a lot of changes. That's where we see changes in our oral cavity. Like other women may say, putting a baby or a tooth for a baby, they lose teeth when they are pregnant, you see? As well as menopause. Ladies that are going through menopause, they can get dry mouth, bone loss, tooth loss, and other health-related issues. And then also birth control pills, because those are hormonal pills, so it does affect our hormones, and then you see the changes in the mouth. Other factors that can also affect your dental health as a lady is uncontrolled diabetes mellitus. Sometimes not even sometimes, every time someone comes to my practice, also form with your details. The next one is a medical history form. Sometimes some people are surprised with why are you asking me all of these health-related questions? It's because the body and the mouth are connected. The body is not isolated from umzimba. So when we ask those questions, then we're able to see, oh, maybe she has swelling because of the uncontrolled diabetes mellitus, or maybe she does have diabetes, but she doesn't know that it's uncontrolled. So diabetes mellitus, when it is uncontrolled, then it can affect your dental health. Other health issues include cancer treatments, heart disease, and respiratory problems, and then immune suppression. When we say heart disease and respiratory problems, I remember during COVID, there were articles written about some of the patients in the hospital are treated firstly by what's mouthwash to rid off the bacterial, or the viral load in the mouth, so that COVID that is very, very severe, So most of the time we do undermine our dental health. We're always covering it, So issues in the mouth, too much bacteria, too much virus, and finally overgrowth, it does affect our overall health. And then immune suppression, maybe someone who's going through organ transplant, and then they need to give them medication, the immune system rejects the new organ. Then they give them medication, and then it can affect their dental health as well. Then certain medications, you find that someone is on antihypertensive, meaning that the person has high blood pressure. Some of the medication can affect your gum health, and then anti-epileptic, that can also affect your gum health, that kind of medication, and then immune suppressive after organ transplant, I said that before, and then also birth control pills. So, getting to Smiling for Two, since we're celebrating Mother's Day, just to give you that advice for your dental health. So Smiling for Two, meaning that you might be a mom who's expecting or has children, so you're basically smiling for two people. So dental health during pregnancy is important. If you're planning to have a baby, just make sure your dental health is in check. Because it's so sad seeing a patient, for example, as your wisdom teeth, and then we tell you that, sorry, we can't treat you because, there's a lot going on. You're literally growing a little baby, and we don't want to use all our x-rays and medication to treat you. It's a risk, They tell you, no, it's fine, you can treat the patient, but should anything go wrong, who's at fault? X-ray or and then things went wrong. So just make sure that when you plan to have a baby, make sure that your dental health is in check, because even some medications are not allowed. You'll only stick to Ipanado, and some people use on Ipanado noma bayiphuza. So during pregnancy, you are prone to having cavities like amazinyabolile, because you know the cravings. You want to eat sugar, you want to eat acidic food, get gingivitis, which is swelling of your gums, periodontal disease, amazinyo alus, pregnancy tumors, not necessarily cancer, but just like an overgrowth of the gums. Then you get tooth erosion because we get morning sickness.